Well, we continue this morning with a topic that may be too sensitive for young viewers. So mom, dad, if you have your kids in the room, you might ask them to go ahead and take a moment and run outside. We talk about what women experience after having children, the body after the baby, women who experience unwanted vaginal changes, including loss of sensation and incontinence. Body changes in the belly region and the breasts are also common complaints. Now, these problems can have a lasting effect on women emotionally. Aguirre Specialty Care addresses these makeover. Dr. Oscar Aguirre is an internationally recognized board-certified gynecologist. He is fellowship trained in urogynecology with over 10 years of experience in reconstructive and cosmetic vaginal surgery. Dr. Aguirre is joined by one of his patients, and Letha Heitman, his patient coordinator. Hi.
Good morning.
Welcome back to the show.
Thank you very much.
This is a topic that may be uncomfortable for many people, but it's so important we address on this show because there are so many women that watch this show and they're thinking, oh, this is it. I can finally get some help. So you have a very successful practice. You've had one since 1999. Please kind of explain how your practice has changed over the last 10 years.
Sure. Well, my practice started off as I'm a fellowship-trained urogynecologist. So since 1999, I've been treating women with urinary incontinence and prolapse, which are the result of often vaginal deliveries and sometimes aging. But over the years, after listening to patients, these patients also came with concerns regarding either changes not just in functional problems that they were having as a result of deliveries, but also some cosmetic changes that they were bothered by. So I pursued additional training and essentially become an expert in both cosmetic and reconstructive vaginal surgery. So I'm able to offer a combination of procedures to correct medical problems such as prolapse, but also some cosmetic issues.
What is the most common request when it comes to vaginal surgery that you hear?
Well, with vaginal surgery, at the time of vaginal surgery, what was interesting over the years is patients were requesting other non-gynecologic procedures, such as liposuction. So a very common request was, you know, while you're lifting my bladder, could you please take care of this excess fat around my belly? And for years, I would refer them to my friends and colleagues who were plastic surgeons. But then with the changes in technology, there were other minimally invasive ways of removing the fat through in-office liposuction. So I pursued additional training in doing that, and so that's something else I can offer to women.
Wow, I bet there's a lot of women at home going, oh yeah, okay, I'm calling 303-223-6162. And how have the needs and requests of your patients changed in the last decade?
Well, I think the biggest thing is people are more open to talking about these personal issues. For one, shows such as this Colorado and Company, which educates the public, but also the internet has been huge. And also reality medical shows, whether it's Dr. 90210 or the Doctor Show. So people are more aware of solutions to very personal changes that occur in women, whether it's just natural changes or due to childbirth.
And when you have children, if you don't think that there's going to be some changes down in that area, you're just wrong. I mean, you're in for a big reality check because that's what happens.
But what's amazing is many women don't have any changes or anything that goes wrong with vaginal deliveries. There are some women will experience many changes that are very negative just from having one baby. And so, in addition to the reconstructive and cosmetic concerns, and the women becoming more aware of these other solutions to their problems, one of the biggest requests that I've added to my reconstructive surgeries have been like labia reductions, and very intimate, personal changes that they want to improve on. But a second big request has been being able to combine many procedures at one time. So combining whether it's a vaginal reconstruction with a labiaplasty or also adding an abdominoplasty or breast augmentation at the same time.
So is that what you call the mommy makeover?
Well, yeah, so the mommy makeover traditionally is referred to by lay people as being breast augmentation and an abdominoplasty. But what we've coined is the term Real Mommy Makeover. And what we refer to that is, well, what sets us apart from the other mommy makeovers is that we address the other intimate, it's really we add the intimate makeover to it, whether it's fixing incontinence and prolapse or whether it's adding labia reductions or vaginal tightening procedures. We can add that at the time of other cosmetic enhancing procedures like liposuction. And if the patient is better off with an abdominoplasty or a breast augmentation, then we combine those surgeries and we refer to kind of our preferred cosmetic and plastic surgeons to come in, and we do a combined procedure with the plastic surgeon and myself.
Tell me about your experience at Dr. Aguirre's.
Well, I had a baby later in life, and I had it vaginally. And after I had the baby, of course, my OBGYN, I had problems with prolapse since I had it vaginally. And my doctor said, well, what we can do is we can just remove it. My OBGYN. I did not go to a specialist. I trusted my doctor, and he removed my uterus. And it was like a wine bottle removing a cork. After that, everything just fell down.
Yeah,
That's what happened.
What she's referring to is the prolapse that she developed after a vaginal delivery. She went on to have a vaginal hysterectomy, and then developed additional problems requiring another surgery 3 years later. By the time she saw me, she was referred by her plastic surgeon, who she was seeing for an abdominoplasty. And she complained to her that she was still having ongoing vaginal relaxation problems. And so she referred her to me, and we were able to combine and essentially do a Real Mommy Makeover. So she had an abdominoplasty, and she had additional reconstructive and cosmetic work, all in one setting. And you stayed in the hospital just 2 days. And
So it was pretty easy then, recovery-wise.
It was fantastic.
Yeah.
I feel he saved my life. I just feel all tucked in, perfect. It's just wonderful.
Good. Well, I know this can be difficult to talk about, so I'm glad that you decided to come on the show. And like Dr. Aguirre said, though, you're educating the other women at home that may be going through the same experience. Letha, tell me about the typical patient that calls the office and kind of like the consultation that you go through with this patient.
Sure. When I answer that phone, Denise, you know, it could be a young mother, as Dr. Aguirre stated, in her early 20s, calling and is experiencing difficulty, as well as women up into their 60s and is at age 70. When they call the office, we're all about educating them, and that's when I like to schedule them an opportunity to speak with Dr. Aguirre in person with a consultation. Or many times, I've even noticed since I've been on the show, the COCO viewers, seeing myself as a mature woman, reach out and just want to chat with somebody over the phone and share their experience. And that's where it's a true blessing to be a part of, making them feel comfortable about what symptoms they're feeling. So definitely we encourage them to come in and have a consultation in our office, and privacy and discretion is ingrained, and we're proud to take care of women.
Well, I think that's a huge compliment on your office, because if women can feel like they can pick up the phone and talk one-on-one, it's going to be private and kind of share and find out, is this normal? Have others experienced this, and is there help? You're looking at pictures of the office, 303-223-6162. And you mentioned you're all about educating. So you're offering a free seminar, an educational seminar.
Yes, we are. So on March 24th, we're having a seminar in our office. It's at 6 p.m. and we're inviting women to come in and learn. And our topic this time is going to be on the Real Mommy Makeover. So it essentially is addressing all the other cosmetic issues that can be performed through my office or in conjunction with plastic surgeons or myself.
Good. Okay. So a lot of questions answered. And momslikeme.com, it's a great website, and it goes through 9 News here. You can log on to 9news.com or go to momslikeme.com. But you're doing a live chat, Ask the Expert. When's that going to happen?
Yes. And so that's what are we doing
early April?
It's early April.
It's early
Okay.
April 5th and 6th.
Yes, and the topic is going to be, again, you know, that's a perfect website that women go to who've had babies, and that they may have many questions that we can help answer or direct them into a better place.
Very good. And tell me about, you believe in paying it forward, which I like, because we talked about this last time you were on the show. But a portion of your proceeds will go to the Kemp Foundation. Explain to me more about the Kemp Foundation.
So, you know, the last time I was on Kohler & Company was very successful, and we had a number of viewers who've committed to even coming in for consultations and surgeries. And so we're paying a percentage of those proceeds on to the Kemp Foundation. And what that does is support, it gives support to people who have had sexual abuse. And that's a big issue in my practice when I see women with bladder pain, urgency, frequency issues. If you dive in deep into their history, there is a sad history there that I want to give back to the community and try to help those people with that.
Well, you were so successful on the show last time because I really feel that our viewers connected with you as a doctor. You're very successful at what you do, and also you, when they call up on the phone, they have that one-on-one consultation and connect with you. So thank you very much.
Thank you for having us.
Thank you for helping the Kemp Foundation. That is a great foundation. Again, Aguirre Specialty Care, well, it's a center of excellence for women, providing everything from urogynecology and cosmetic gynecology to body contouring and dermal aesthetics. We really encourage you to attend Aguirre Specialty Care Seminar, the Real Mommy Makeover, on Thursday, March 24th at 6 p.m. There will be a special seminar-only pricing available at this presentation. It's free and it's open to the public. Space is limited, so register today. Here's a number you can call. It's 303-223-6162. And as a special offer to you, our Colorado and Company viewer, Aguirre Specialty Care is offering a certificate for a complimentary ASC photo facial. That's valued at $400 for each viewer who receives a consultation with Dr. Aguirre. And as an additional incentive, the first 10 Colorado and Company viewers who schedule a consultation will also receive an amazing eye product that many of you may have heard about. It's Latisse. Oh, your eyelashes will grow. That's a $120 value, and it's yours absolutely free. Be sure, though, to mention Colorado and Company when you call and schedule your appointment. The number is 303-223-6162. You can also visit ascdenver.com. And again, a percentage of all proceeds generated from Colorado and Company viewer consultations will be donated to the Kemp Foundation. Aguirre Specialty Care paid for this segment.